You're live.
Hello, everyone. Hi, welcome back to another interesting episode of Tea Talks Tuesday. And I hope everyone are celebrating Navratri full of dandiya, playing dandiya, garba everywhere. And here in Telangana, Batkama is going on. I hope all of you are busy with fasting, festivals, sweets and everything. Yeah, without any delay, we'll just move on to our today's session. Over to Dr. Janaki, ma'am.
Thank you, Mayuri. And once again, welcome all of you and very good evening to all of you. Welcome to Tea Talks Tuesday once again. And before we start, I want to express our gratitude towards all the participants who did share their hobbies during National Nutrition Month. And it was really wonderful to know all of you, the other side of you. So keep posting. You can still keep sending. We can still post them in the Tea Talks, so that the N2 keeps going on. So today's topic is very interesting. I'm sure all of you might have already read this, but I just want to read out this to you. What if the diet plans are ready for you at the click of a button? I'm sure all dietitians are practicing nutritionists would be really be elated to know that. And what if the patient or client is being monitored? That's very important in our practice, and then updated according to your instructions. So there is one interesting, amazing app which is going to be presented today in our Tea Talks today by Dr. Jamuna J Bhaskar. She is the Manager Clinical Excellence and Research in QurHealth. QurHealth is the company, or QurHealth is the app. Now we'll get all the details we'll know with Dr. Jamuna. So let me introduce Dr. Jamuna Bhaskar to all of you. She has 10 years of experience, MSc in biotechnology and PhD in biochemistry, PG diploma in clinical research, MBA in healthcare management, and that's a deadly combination all put together. So presently, she's leading clinical excellence team of 45 plus members at QurHealth. Previously, she worked as a guest faculty in Jain College, ICRI Bangalore, and Drug Safety Associate, IQVIA. I think you have to expand this for us, Healthcare Bangalore, and a Senior Research Scholar, Biochemistry and Nutrition Department, CFTRI, Mysore. I'm sure CFTRI is very famous for all of us. PhD research was on effect of banana flower and how do you spell this? Pseudostem on advanced glycation end products, AGES, and glucose transporters, that is GLUTs, in kidney during diabetes. Published 11 research articles in international journals, national and international conferences she has attended, and she was awarded Best PhD Research Scholar at CFTRI in 2011, and she was awarded Best Poster Presentation in 2009, and she has to her credit 50 plus certificates and medals in academics, sports, and cultural activities. So we welcome Dr. Jamuna. So stage is all yours. Let us know what you have in store for us.
Yeah, thank you, Dr. Janaki. So I would like to now present my screen. Yes. A very good evening to all of you. I thank you all for joining this meeting. I'll be presenting today about our company, QurHealth's QurOne Care Concierge Program. And also, I'll be giving you a demo about the diet plans in our QurBook app, because this is a forum of all dietitians. So at QurHealth, our vision is mainly to provide personalized healthcare, saving life super proactively. And who we are. we are actually a value-based personalized patient care concierge company. We are aiming at providing improved health outcomes. Our main goal is to provide safe and trusted experience by improving the patient's quality of care through our care coordination service. And we want the patients to get engaged with all our care coordinators and care providers, especially the doctors, dietitians, and other care providers, including the physiotherapists, psychiatrists. We also aim in providing proper patient education, where a lot of queries patients have, which they are not able to ask doctors or dietitians during the consultations. So let me introduce you to our leaders. Our CEO and founder is Ravi Kundaru. Our Chief Financial Officer is Randy Fogel. And Ravi Kiran is our Chief Technology Officer. Chief Partnership Officer is DJ Nag. And our country head for business strategy and development is Tyagarajan. And myself, Dr. Jamuna, I'm leading the clinical excellence and research team at QurHealth. Let me first talk about Ventec Solutions, because Ventec is our parent company. Since 28 years, our founder and CEO, Ravi Kundaru, has been running Ventec Solutions in US. This company is managing world's largest healthcare quality data. We have more than 800,000 plus providers nationwide, and we have collaborated with more than 6,000 plus hospitals and 7,500 dialysis centers. So healthcare industry for us is not new, because we have been doing it since 28 years. And in India, QurHealth was started recently, 4 years back. And because we have been growing at a very enormous and fast pace, presently we have tie-up with 112 hospitals, including 2,000 doctors and 243,000 patients. We have tie-up with various hospitals, including multi-specialty hospitals and also the individual clinics. Basically, we are located in 4 main regions: Bangalore, Hyderabad, Delhi, and Chennai. Because our company is growing at a very fast pace, we are trying to expand our branches in various other states in India. So what is this QurOne program? In QurOne, we offer Cure plans, which actually is a personalized care coordination plan, which will help in disease management, symptom management, care adherence, and remote monitoring, which is being provided by our trained care coordinators, who are basically nurses with more than 6 to 8 years of experience. We have set early comorbidity alerts in our QurBook app. Additionally, we have a feature called Sheila in our app, who is a conversational AI ML personalized healthcare assistant. So Sheila makes sure that the patient is care plan conformance, patient has a check over his vitals, and Sheila also provides a patient education. As a patient, you can ask any question related to your health condition as well as related to your diet. She is multilingual in nature, because we have set various different languages which the patient can choose based on his or her region. And I can also proudly say that we are HITRUST certified and HIPAA compliant. We have also FISMA compliance. So all the data that we handle in QurHealth is safe and secure. What are the benefits for the patients that we provide? The patient, whenever is downloading our app and subscribing to any care plan, we assign them with a care coordinator who will be monitoring their vitals, symptoms, and everyday activities on real-time basis. We have trusted patient education, because whenever a patient wants to understand about his or her health condition, The patient search for various website sources, they search online, and finally they get confused. But here we give them authenticated answers because these answers are being approved, reviewed by our specialist doctors and dietitians. We have set early comorbidity alerts in our app. So the patient gets to know whenever the values of their vitals, example, blood pressure, is above normal range or below normal range. So what are the benefits for the doctors and the dietitians? So we tell that 12 proactive life-saving benefits are being provided on our platform. Whenever the doctor or dietitian or any care provider signs up with our QurOne program, we provide them all these benefits. So in one click, all your healthcare needs are being taken care. So you will have a direct access to our care coordinator team, which we call as Care Concierge team. We have personalized care plans and diet plans, which has now been increased to 1,000+ number. And as I already mentioned, your health assistant, Sheila, will be providing you patient education and also monitoring all your health conditions. Then remote monitoring will be done by our care coordinators. They will be taking care of your health needs. And the patient will be on a regular follow-up with doctors as well as the dietitians. So how does this work actually? So whenever a patient is downloading the app in Play Store, we have made QurBook app for the patients, QurPro for the doctors and dietitians, and QurPlus is a dashboard which we set up at the hospitals and the clinics. So how this work in coordination, I would like to explain. So the patient first downloads the app from Play Store. It is for free, available. Anybody can download it by entering your details. So once the app is being downloaded, whenever the patient is going for a consultation with a doctor or a dietitian or any healthcare provider, after the consultation, the doctor or the dietitian advises the patient to subscribe to the respective plan that suits their health condition. For example, if a patient is diabetic, the doctor would have prescribed, okay, you can take this medication and download this app and subscribe to type 1 diabetes care plan. And dietitian would recommend to download the subscribe for the type 1 diabetes diet plan. And likewise, the patient would get to see all the activities that we have added for that particular health condition in the app. So I would explain that in detail when I give a demo of the app through my mobile. Likewise, the doctors and the dietitian can monitor the patient's condition through the QurPro app, as well as whenever the patient is entering the vitals or the symptoms or adhering to the activities that we have provided in the care plan or the diet plan, the doctor gets to view it in the hospital or the clinic dashboard, which we would have set up for them. So how we do all this? Basically, we have a clinical excellence team with 45 members who are experts. It includes research associates who draft these care plans and diet plans through desktop research. And we have care coordinators who are trained nurses who are well versed with all the health conditions of the patients. And they monitor the health condition of the patient whoever has subscribed to a respective care plan or diet plan and do regular follow-ups with them and help in like booking consultations with the doctors or the dietitians. We have medical content developers who draft these question and answers through desktop research, and medical editors who validate all these question and answers. Every care plan or diet plan that we design in our clinical excellence team is being sent to our expert specialist doctors. We have more than 20 doctors and dietitians in our team who review all these care plans and diet plans. And after their approval, these plans get added in the app for the patients to subscribe. Because we provide the question and answers to the patients in various languages, we also have a team of translation validation experts who check all these answers, whether they convey the right message. Because this is a forum of dietitians, I would like to introduce our clinical excellence team dietitians. And Dr. Janaki Badugu, she doesn't need any introduction because everyone knows her. And she's the one who is guiding us for adding various diet plans for different health categories. So our dietitian Anita is also a consultant SME in our team. She's based out in Bangalore. She has also more than 20 plus years of experience, and she reviews and approves our plans. And Sutapa is the one who is the mastermind behind drafting all these diet plans. She is a Bengali and she is a foodie, hence she knows varieties in diets. And she has made sure that the patient doesn't feel like it's a punishment for him or her to have a diet related to the particular health condition or a chronic condition. So she has made sure that she gives variety, as well as she has also made sure that the diet plans satisfy the patient's taste buds. We have Sushma, another dietitian in our team, who is supporting Sutapa in doing all the diet calculations, as well as the diet menu preparations, and also the images that we add for every diet plan, which comes finally in the app. So I can proudly say that we now have covered more than 30 health categories, and we have added more than 1,000 care plans and diet plans altogether. So we have covered almost all categories, including women health, men health, the neuro, cardio, pediatric, rehab, podiatry, you name it, and we have it. So this is the graphical representation of the care plans and diet plans under different health categories. The one which you see in blue represents the number of care plans we have under that particular health category. And the bar in green represents the diet plans that we have under different categories. In total, we have more than 800 care plans under all health categories and more than 230 diet plans under different health categories. So hence I mentioned that we have 1,000 plus care plans and diet plans in total, and the number is increasing day by day. One unique feature of our diet plans is that we call them as therapeutic diets. Why do we call them as therapeutic diets? Because these are researched foods with therapeutic values. These are being planned by our expert dietitians. These therapeutic diets are treatment facilitators for chronic health conditions. And we have added variety in menu and which satisfy the taste buds. For example, when I say like we have anti-diabetic diet plans, I mean that these have therapeutic value, which would help in controlling the blood sugar levels of the patient. These diets, which are anti-diabetic in nature, are low in glycemic index. Hence, along with the medication that the doctor is providing them, the patient is also able to control his blood sugar through the diet that we provide them. We have diet plans for every specific condition, again under diabetes, type 1, type 2, gestational. And again, we have taken care of providing the diet plans region specific. We have North Indian, we have South Indian, we have continental. And also in every region specific plan, we have veg and non-veg. So when we say type 1 diabetes, we give them with 6 different options: South veg, non-veg, North veg, non-veg, and continental veg, non-veg. So the patient has different combinations to choose. We have almost covered all the health categories, and we have provided diet plans in every health category. For CKD related patients, we have provided them with the dialysis and non-dialysis diet plans In dialysis diet plans, we have taken care of salt restrictions, especially the sodium and potassium, and also for dialysis patients. So we have made sure that the protein content is high. We also know that chemotherapy and radiation therapy for cancer patients is like a very crucial thing. And these patients face a lot of side effects, especially when they are under radiation or chemo. They are unable to have food. There's loss of appetite. They have issues like constipation, diarrhea, mouth sores, vomiting, nausea, and all that. So we have come up with post-chemo diet plans, which would help these cancer patients to maintain their health condition and have food, which would be scheduled every 2 hours, and the soft diet based on the chemo side effect. We have diet plans for breast cancer. We have hormone balanced diet plans, which include hyperthyroidism and hypothyroidism condition. And for bone health, we have provided with calcium rich and vitamin D rich diet plans. We have for skin health, eye health, and for obesity, especially who focus more on weight loss. For them, we have provided with low fat diet, and we have increased the complex carbohydrates in that. We also have post-surgery soft diet plans. Some of our doctors, especially the ENT surgeons and also the dental surgeons, they requested that their patients after the surgery, they're unable to have the regular food. Hence, we designed these post-surgery soft diet plans for their patients. We have anticoagulant diet plans for cardiac patients because after a cardiac surgery, they are advised to have a vitamin K restricted diet. So in these diet plans, we have avoided all green leafy vegetables. And immunity boosting diets, which is more needed for COVID situation, and fertility diet plans for men and women, and also for those who are taking IVF treatments, and anemia diet plans which are rich in iron content. So this is the varied diet plans that we have under different health categories, and this is specific to their health condition. Hence, our dietitians have designed it through enormous research, and our expert dietitians have reviewed and approved these plans, which are readily available in our QurBook app to subscribe. So now I would like to share my mobile screen, and I would like to give you a demo about our app. So I hope you are able to see my mobile screen.
Yes.
Yeah.
Yes,
Okay.
yes.
Yeah. So once as a patient, if I download the app, this is how the app looks, QurBook and QurPro. So now in this meeting, I would like to explain more about QurBook. So once I click this app, this is my dashboard. Here in QurBook app, we have care plans, we have regimen screen, we have vitals. Vitals include blood pressure, glucometer, thermometer, pulse oximeter, weight scale. So here, as a patient, if I want to enter my body weight, either I can type it by entering my body weight. So that gets saved. Or I can even save it by telling it to Sheila. $70. So when you can either type it, or even you can tell it through Sheila. She's going to save it, and this will be recorded here like this. See, for example, if I have entered the body weight for 72 kgs, it gets saved for that particular date and time. So likewise, I can enter all the vital readings in the vital section. I have a symptom category where the symptoms related to my health condition will be listed. I have the option to even add my family members. Along with me, I can add my husband, I can add my children or my parents. So whenever I add my family members, I can also monitor their health condition through my app. The providers list includes the doctors or the dietitians that you are consulting. And here you can directly book appointments with these doctors and dietitians. We have the option of help where we have provided with all the different videos that would help the patient to subscribe to the app, how to use the features of the app and all those details. And chat with us option makes available for the patient to chat with a care coordinator. Like I said, whenever a patient is subscribing to any care plan or diet plan, one personalized care coordinator is being assigned to them. So through this app, they can chat with the care coordinator. Now let me explain in detail about the care plans and the diet plans. So now as a patient, now I want to select some care plans and diet plans for my health condition. I click on add plans. Here, I get all the health categories that we have. Like I mentioned, we have 30 plus health categories. So I can choose a health category relevant to my condition. So as a patient, just for example, I click on kidney care and I get to see list of all the kidney care related care plans in my first screen. So here I have the option to choose whichever health condition I am. For example, I'm choosing CKD stage 3A care plan. Before choosing the plan, if I want to know the details of the plan, I can click on the plan and I get to see 1 or 2 page summary, which would explain about what the care plan is, what is the scope of the plan, who can subscribe this plan, what are the symptoms and vitals, and also what are the activities that we have included. This summary will help the patient to understand, okay, whether this plan is relevant to their health condition or not. So once as a patient, I select this, I have the option to select the diet plan also relevant to the condition. So under CKD, like I said, we have for dialysis as well as non-dialysis patients. Because CKD 3A comes under non-dialysis category, now I'm choosing CKD non-dialysis North Indian Veg plan. So once I choose these plans and I do the payment, these both plans get added to me. So these are the 2 plans that have got added. In my regimen screen, once I click, I get to see the list of activities that have been added in the care plan as well as the diet plan. So every care plan is being divided into scheduled activities, as needed activities, and then symptoms. Scheduled activities are those activities which a doctor is advising the patient to do on particular timing in a day. So for this CKD patient, morning 7 o'clock, the advice is given as knee rotation for 10 minutes. In the description, the patient also gets to see what actually this is, why knee rotation is important. And also our care coordinator will explain about this condition, like activity to the patient, and also they will be sharing the link that would help them to do this particular activity. Likewise, we have diet plans because now I had subscribed for both care plan and diet plan. The diet got merged along with this, and here I have the option to see my breakfast and other meal menus. So for every meal option, 7 varieties have been given. Like for example, the patient can choose any one of the menu for a particular day. For today, if I choose this menu, that gets saved. So the doctor or the dietitian can monitor if there is any change in the patient's health condition. For example, if it is a diabetic patient and the doctor gets to see that there is a change in the fasting sugar levels for 2 or 3 days, the doctor can monitor and go back and check what has happened with this patient. What did this patient have since 2 or 3 days, which has which is the cause for the increase in blood sugar levels. Likewise, for CKD patients also, if there is any change in their blood pressures or even in their salt levels, the doctor can monitor this. Okay, this is because of the diet that they had. Hence, we have given this option. Even whenever the patient is unable to choose choose the diet from whatever we have given, the patient can also enter the image or type whatever the patient has had for that particular day. So like this, I can save it. So if I have had morning snack, which is different from the list that is being provided, I can just add it here. And also I can take the image of that particular diet plate or the meal plate that I have had. So this is about the scheduled activities that we have given. And then we have the as needed activities. Under as needed activities, we have included all the lab tests and all the diagnostic tests, which the doctor would inform the patient to do it whenever their health condition is getting worse or any additional or adverse symptom is being experienced. For example, every monitoring of the blood pressure is compulsory for a CKD patient. So here I have the option to say whatever blood pressure I enter. 90. So if I enter these values, it gets saved with that particular date and time. So whatever I'm entering in this app can be monitored by my care coordinator in her system. And also this will be appearing in the hospital or the clinic dashboard that will be set up for the doctor or the dietitians. So likewise, we have the list of symptoms. Under list of symptoms, these symptoms are specific for that particular condition. So here, because I have with the CKD plan, all the symptoms here will be specific for the CKD condition. So definitely all patients will not be experiencing all the symptoms at a time. So whenever that particular patient is experiencing any symptom, that patient clicks on that symptom. And also we have the option to enter the severity of that condition. For example, as a patient, if I'm experiencing lower back pain, I can enter whether it is mild pain, moderate pain, or the severe pain. So whenever I enter this, it gets saved for the particular date and time. So if a particular symptom, which is a really serious issue, and the patient has a concern about that, the care coordinator immediately books an appointment with the doctor. So this is how we say that we do monitoring on real-time basis, and our care coordinators do follow up with the patients on a regular basis. And they also help the patients in adhering to the activities that we have provided the patient in under the scheduled activity section. So this is all about the care plans and the diet plans that we have. And also one more feature that I would like to explain is that whenever a patient feels that, okay, this is not my time schedules and I want to change my schedules. So the patient has the option to change the wake up timings. So all the activities that we have added are based on the wake up timings, sleep timings, and the different meal timing. So as a patient, if I say like, okay, I wake up at 7 o'clock, I can change it. I can change the time accordingly. So here, the patient has the option to set his own timings. And also we have provided the option of enabling and disabling the activities. See, for every activity, the patient will be getting an alert or the notification. Okay, so for example, 9 o'clock breakfast, the patient will be getting a notification. It is time for your breakfast. or it is time for your knee rotation activity. So for every activity, the patient is getting an alert so that the patient doesn't miss any particular activity. And for example, 6 p.m. patient counseling. Before that 6 p.m., a patient gets a notification, okay, this is the time for your counseling. Or even if the patient has missed that activity, the patient will be getting to know that under the missed activities section. Now, if as a patient, I don't want alerts for some of the activities, for example, if I don't want an alert for sleep cycle, I can disable it. Okay, so once I disable this, then I'll not be getting a notification that it is this time for my sleep. So these are the options that we have added. And under missed activities. So if a patient at the end of the day, the patient wants to know, okay, have I followed all the activities, or if I have missed any activity, then under missed activity, the patient will get to see all the activities that he has missed for that particular day. So these are the options that we have for the care plans and diet plans in our QurBook app. Along with this, like I mentioned already, we have Sheila feature. Then Sheila is the AI-based multilingual health assistant, personalized health assistant. She will be monitoring your vitals, and she'll be recording all the readings that you tell her through voice. And also you can ask questions related to different health conditions, and she will be able to answer you. So here I have the option to set the language. If I'm a patient who doesn't understand English and I want to set my language in Kannada, I have the option to change. So now the language is being set to So once I set the language to Kannada, so Sheila will start conversing with me in Kannada language. So like this, I have option to select almost more than 10 different languages. So for any patient, even though they are not from the highly educated background, even if it is a layman, it is easy for the patient to subscribe to our care plans or diet plans. It is easy for them to converse with Sheila through the app. And we also have the care coordinators specific for every region. The care coordinators in our team have been selected based on the language that they know. For Bangalore region, we have Kannada speaking care coordinators. Likewise, for every region, we have made sure that they know the regional languages. So whenever they talk to the patients, they talk in their regional language, and the patient feels good, and the patient also creates a bonding with the care coordinator. So this is all about our care plans and diet plans. Along with this, we have even the option for the patient to save the prescriptions, device reports, then lab reports, then medical reports, bills, then other documents, along with the voice records and hospital documents. So patient don't have to maintain any kind of hard copies, or the patient doesn't have the fear of losing any kind of hospital documents. Everything can be saved here. You just have to click, take a picture, and just save it. All your data is saved, and this is what I mentioned. In one click, you have all your health needs being addressed. So now I would like to Okay, so thank you for your patience. And now I would like to answer to any of the queries that you have related to the app, and also related to our QurOne program that I had explained now. And I also have my dietitian Sutapa with me, who can also answer to the queries that you have related to diet plans in specific.
So Now, all of you can, whoever is listening, can, if you have any questions, you can ask. That is quite extensive and very to the point and very clear. And this is for general population, in the sense of, this is for the demo which you have given is for the patient or the client. What will be for a practitioner? How different it will be for the practitioner?
So practitioner,
Like especially dietitians and nutritionists.
dietitians. Okay. So for dietitians, doctor, like once the dietitians said like sign up with us on the QurOne program,
You can close. Sorry, you can close the screen share. If this is the last slide, you can close the screen share.
This slide, I have mentioned all the links that you can search for us in YouTube, then LinkedIn, Twitter, and Facebook. We are available on all these platforms. And I have mentioned about the contact numbers of our sales managers belonging to different regions, including Delhi, Bangalore, Chennai, and Hyderabad. So whoever is interested in signing up with us on QurOne program, kindly contact us through these numbers, and we will arrange call with you, or even our sales managers will come and contact you directly in your clinic or in your hospital. Okay. So, so doctor, whenever we, as dietitians, you sign up with us on a Care Concierge Program or QurOne program, what we do is we provide you with a list of all the diet plans that we have under various health categories. So whenever the patient comes to you for the consultation, so you understand their health condition, and you tell them, okay, you can download this app and you can subscribe to this particular diet plan in the app, and we will set up the dashboard in your clinic, which will be in your clinic name. So whenever the patient is downloading the app and trying to subscribe to any diet plan, they will be doing it through your clinic. So that will option we have made available for all the dietitians. So our sales managers will come and sign up with you, and they will usually have a standard contract that we sign for the number of years that you agree for, and also the business things, whatever is there, like usually they take care of it. And once you sign up, then we take care of your patients. See, the patient is subscribing to any diet plan. We have our care coordinators who will explain about the app, who will explain about the diet plans. And if they have more queries related to diet plans in specific, we have our dietitians, Sutapa and Sushma, who will be talking to the patients and explain them how they have to adhere to the menus that we have mentioned in the diet plans, and why they are of high significance for their health condition.
So in that case, I mean, when you guys are explaining, then what is the point of a dietitian enrolling on to the QR app? See, if my client is coming and taking the, okay, see, I'm a dietitian. Let's take, I have taken the subscription of QR app, right? And if I give this, facility to my client, definitely automatically they are coming to you. So what are the perks that I'm getting, and how is that, how it is different from services that you're giving for a dietitian?
So actually, doctor, what happens is, so whenever we sign up with you, we have an agreement signed. Like, for example, it is like sharing basis, like 50-50, 60-40 and all that. So whenever a patient is subscribing to any plan, it's a sharing basis, the amount goes to you, because they are going to subscribe it through the app and also through the clinic that you have signed up with. So the payment goes to you first, and then based on the business contract, whatever.
I understand.
Yeah,
I understand, Jamuna, what you're saying. But when the client is coming to you, coming to me, example, he's coming to me because he knows me.
Yes, of
right?
course.
And
Yeah.
now when a third person enters and he or she explains about the diet plan, won't there be any mismatch between the kind of counseling that I do and the kind of services provided, I mean the dietitian who is going to talk from your side to the client? Won't be there be any mismatch, or or
No,
any?
no, doctor. Actually, what happens is, whenever we start our care coordination service with the patients, we first have a talk with you. So our care coordinators will be having a call with you. They'll confirm about the health condition of the patient, and then even the if the patient wants to have a consultation with you, we arrange the consultation with the respective dietitians only because if they have queries related to the menu, only then our dietitian will explain about the menu. Otherwise, whatever you customize for your patients, see, for example, you say that, okay, my patient is a patient with some heart issue, and for my patient I want this restricted calorie restricted diet, and this is what you need to customize for my patient. Then our dietitian Sutapa, she will note down what all you mentioned, and they draft the diet plan accordingly, because we have to add it in the app. So
Right.
for that, we get the images like I showed in the mobile screen.
Got it.
So
So
all that will be
as
done.
a dietitian, I won't be able to make those customizations.
You can also make the customizations, doctor. If
So
you say,
I
okay,
will be able to edit those diet plans which are done previously. I mean, you have like set of diet plans already, right? So when I'm on board from as a QR under QR app, and so my client is there. So if I need any specifications or any changes, of course, diet plan is definitely personalized, right? So there can be minute changes here and there. So that will I be able to do it from my end, or it has to be conveyed to you then, and then only your dietitian will be making those changes? How it is?
we can share you our template, doctor. So
Okay.
what happens is, in that you can provide all the changes that you need, and then we upload, because this is again a technical related thing, because whatever you see in the app comes through the tool. So
Right.
on the back end, the menu you can provide us, the all the calculations you can provide us. We upload that into our system, then we add the respective images for that. Then it is made available for your patient in the app.
Okay. So I mean, it is more I mean, the work is done by you again.
Yes, doctor. Because
You can call me Mayuri Jamuna.
okay.
I'm not a doctor. I'm a dietitian.
Yes, Mayuri, we do because for customization, this is what we follow. Even to the doctors, for example, a diabetologist or cardiologist, whenever they say we want customized care plans for our patients, where the monitoring is different for sometimes there is a change in the treatment protocols for
Right.
among the different doctors. So we provide them with the customized care plans. Likewise, for dietitians also, we can provide customized diet plans, and we have done it for IVF diets, especially for Delhi doctors. We have customized these IVF diet plans, and they had specifically mentioned about particular menus. So we have done it, and the same thing can be followed with all other dietitians also.
Okay, great. And is it Android app, or only Android app, or is it iOS version is also
Both.
available?
We have both. We have both.
You have both. Okay, great. Yeah, let's wait for any more questions from the audience.
A dietitian can actually make use of this app for monitoring and for assistance, and give instructions to the care coordinator or Sheila, so that whatever changes that the dietitian makes, those can be incorporated.
Yes, yes, doctor.
This is the main support that dietitian gets, I think,
Yes,
to make things easier for practice.
yes, doctor. Yeah.
Because as
And
Mayuri said, there'll be so many changes each day. They may be changed. So many, even though if it is so the same rice, same dal, same chapati, or same fruits, same vegetables, you have seen so many diets are there. So each individual also we keep changing them. So that customization is what makes the practitioner unique.
unique. That's
So once we get into app, it will be more like same to everyone kind of thing. So this customization part is what is very much is needed for practitioners.
Yes, yes, Dr.
If the
You're
app
right.
can provide that, then I think just by taking instructions and doing the needed changes, I think that will be really great support for practitioners.
Practitioners, actually.
Yes, yes, doctor. True. What you're saying is true. And also presently, we have been adding in the summaries for all the different kind of tips and restrictions in the diet. So we are also planning to add the calories and also the carbohydrate, fat, and protein content along with the images that we are providing. So we are working on that also. So in future, if customization of the every plan based on calories and even all these nutrient values is being asked by dietitians, we will be able to provide it to them even directly through the app.
Right. And when the person is not following the diet, as you said, the client can monitor everything. So when the client is not following, the patient is not following, and the person has had something else, then the person can actually take the picture and keep it
Yes.
so that we understand that instead of this person has taken this. Okay.
Yes, yes, doctor. We have kept that picture option because of that, because sometimes whatever menus we give, the patient might not have the ingredient to cook. So sometimes they would be having some other ingredients. So if they have had some other diet for that particular day, they have the option to take the image and also write notes. So whether they can write
Right.
it or take the picture. And this can be checked even by our care coordinator as well as the dietitian in their clinic dashboard.
Okay.
And for dietitians, it's a dashboard app, or is it a mobile app again, or just a dashboard app? If I am a both.
What you can do, you can also use this through QR Pro or
Okay.
even through QR Plus, which will be set up at your clinic.
Okay, great. So it's both mobile friendly and even the desktop thing, right?
Yes, yes.
Okay, great. And I mean, do you have any facility of sending the reminder messages for the clients? You know, if by any chance, you know, if they're missing the diet today, or, you know, such generalized messages.
Yes, that is what I showed. The notifications will be up.
Oh, great. Okay, okay. I just remember. Got it.
We have even the enable and disable option for that. See, for 9 a.m. breakfast, I'll get a notification just 1 or 2 minutes.
And what if they have eaten everything? Just say example, like I have I'm a patient and I have taken today's entire diet plan. Are there any acknowledging messages?
Acknowledging messages,
Like, wonderful, you have done a great job that you have eaten everything, or, you know, such kind of acknowledging messages, or just motivating them as if they have missed like that, or motivating messages or something like that, where, you know, I mean, that's how, you know, people needs this kind of pampering kind of thing, right?
Yeah, true.
So
what you're saying
when
is
it is an app, mobile app, so that is how, you know, it makes them feel good factor kind of thing, right?
Yeah, true, true. We'll make sure that we'll consider your point. It's really a valid one. So we'll make sure that we add this in our next version of our app.
Great.
So our app version keeps on updating and we keep
True.
updating it. Yeah.
True.
So we'll surely add this.
The compliance meter you can have.
Yes, yes. We have that care, the adherence report we can provide, doctor. Like, see, whenever a patient is adhering to all the activities that we have mentioned in the care plan and diet plan, the percentage of adherence report, we get it through the.
So if it is 100%, you can send out the motivating
message.
Yeah, true, true.
And even if they miss out also, we can send a motivating message that that's okay, fine for today, but make sure that you fall on track or something like that.
Yeah, true.
It's okay to be not okay.
Not okay, right? That is how, you know, people, I mean, you know, the clients need.
Yeah, true.
Yeah, constant reminder, constant touch. Actually, this app is having that kind of facility because constant notifications are being, reminders are being sent. So now from the other side, acknowledgement of that they have done good job and things like that. So you were mentioning about early comorbidities, checking on the early signs and symptoms. That is a very good thing. If we use this app correctly, appropriately, constantly, we can actually save a lot of fatalities.
Yes, doctor. Yes. See, especially when we talk about chronic conditions, for example, CKD. We know that CKD keeps progressing from one stage to the next stage. And here, main thing is we have constant monitoring is very much needed. So, and we try to prevent the patient from progressing to the next stage through the care plan as well as through the diet plan. So hence we mentioned that comorbidity monitoring is mandatory that we do through our app and through our care coordination service.
Any questions?
As of now, no questions on Facebook, doctor. It's like, everyone has liked the the app, nice app. Yes,
hi,
Priya.
ma'am.
Yeah.
This is Priya from Chennai. So I'm a freelance nutritionist. So I have a doubt in the health record session. You have mentioned that the patient can record the daily dietary intake, right? So is it possible to download for us to download and review it later? Does your app
as a
provide
practitioner?
that? Yes.
Yeah.
So download of
no, she's asking as a
intake.
practitioner, if my client has followed everything and has adhered to the all the the diet plan things,
yes,
will I be able to download the
yes,
report?
of course. Yeah, of course. In your dashboard, you have the option to click on your patient, and once you click on your patient name, you get a complete report of the patient, like whether the patient has adhered in the sense whether the patient has followed the menu that you have given in their particular diet plan. So for care plans also, the activities, the vital checks and symptoms, all that report you will be getting to see in your dashboard. So you can pull the report even on a daily basis, weekly basis, monthly basis. The option is available.
Okay.
So it will be saved date-wise with time.
Date and time.
Yeah.
Okay.
So
Thanks for the wonderful session, Dr. Jamuna. Thank you so much.
Yeah, thank you. Thank you, Priya.
So Jamuna, in continuation to this, I have another doubt. So now, as you know, do we have to do it, manually, like, every day? If I need today's report, I have to do, or do you have any facility like every week, by setting a reminder or some algorithm where, if for this particular client, I need it every week, and for some particular client, I need every day. So in such cases, any automation, any kind of automation is there to download the report?
Yes, Mayuri, it is made available likewise, because it again depends on the doctor or the dietitian's time, right? You will not have on daily basis time to check on the patient's condition.
True.
We have made it available for them in the dashboard that they can either check it on weekly basis or even pull the report on monthly basis, because all the patients will be listed out under your clinic dashboard. So if you have like 500 patients, all 500 patient list will be available.
Great. Okay.
So you very clearly explained. So we go whatever doubts we had, we asked you.
We have asked. Actually, we had doubts. And it was great app actually. Yeah. So I feel from as a dietitian perspective, probably you need some little more changes, where I have asked, like, my client coming to me, and then you people making the changes. Rather than that, if you can give that entire thing to a dietitian, where she can do the customization. If I'm on board of your QR app, something like that, could be helpful again. That is one point. Apart from that, as a client perspective, the app is great. If I'm a client, I would definitely love to use that app.
Thank you so much.
Just one request, on T-Talks account or page, you can again repost the links and the phone numbers under comments. In the comments, you can so that maybe people may not go through the entire sometimes. So to be ready.
Yeah, surely I'll do that.
Anyhow, we'll have the recorded session and we'll be uploading on the YouTube. But still, if you can, put one shootout on Facebook, it would be great again.
Okay, sure, I'll do that, Mayuri. Yeah. Thank you so much for providing me this opportunity, Dr. Janaki, as well as Mayuri.
It's a pleasure. It's a good, nutrition is integrating into many things, and technology is one of them. And we are, and we have to, and a few years, very shortly, maybe 5 years or less than 5 years, everyone is going to use technology and 100%.
Yeah.
So we need this kind of.
It's no more for the techies or the technology is not just meant for techies. Now everyone needs to learn the technology.
Yes.
Yeah, that's true.
Though you are a dietitian or a doctor or whatever it is, everyone needs to learn technology.
Yeah, everyone has to go through the mill.
Yes. Yes, doctor. I mean, as of now, we have no questions. I mean, everyone liked the session. Very informative and very nice session. These are the message compliments. Yeah.
So shall we say
doctor.
Vote of thanks?
Yes, doctor. Yeah. Thank you, Jamuna. Thank you for being here on Tea Talks Tuesday. And it was great session, and it's a great app, future app, which is going to be very useful for all the clients. And we really loved this session. And thank you so much for being here on Tea Talks Tuesday.
Yeah, thank you. It's my pleasure.
And thanks, Shuttappa, for being here.
Yeah, Shuttappa.
Yes, on a just an ending note, I would like Madhuri ma'am, and obviously Janaki ma'am is my mentor, so I need not to tell her anything. But it's just that I have learned so many things. So I would like you to just go around and shuffle the app, ma'am. So the more you will play with the app, you will find, and let me know also how's the menu you are checking out, because the more feedback we'll get, we will be more passionate about our work and we will be more flawless. So that's the thing.
Sure.
So Janaki ma'am, I'm not addressing you because without you it's not possible.
Thank you.
Sure, definitely.
Good. All of you who are here can do that. Yeah.
Sure, Satapa, I'll definitely go through that. And thank you all for today's Tuesday session. See you all next Tuesday, same time, same place. Bye-bye.
Bye. Thank you.
Bye. Bye.